everyone, how's it going? It's Dr. G. Fernando with Infectious Disease here with another update on COVID-19. Let's actually start with some positive news today, which is we've had some positive things with the treatment of COVID-19. So let's talk about where this is. So first of all, the world is participating in a trial called the RECOVERY trial. The RECOVERY trial really points out drugs that have the potential to be good to treat COVID-19, but not really studied. Now, for example, let's take the examples that we had so far. In March, there was some promise about using a drug called hydroxychloroquine for malaria and azithromycin. Since then, that has been debunked. So take this out of the thing. Azithromycin should never be used, and hydroxychloroquine should not be used as well. I know there's some politicians which suggest this is beneficial, but actually on the flip side, it's been shown to increase death by cardiac arrhythmias. The other drug over here, we have an HIV medication called Kaletra, which has not been shown to be useful. Tocilizumab is another agent, which is an interleukin-6 inhibitor. That showed lukewarm results, so not a slam dunk. The slam dunk drug, which I'm going to talk about today, is dexamethasone. Now, dexamethasone is a steroid and was studied in the RECOVERY trial, and finally it's shown to be beneficial in treating COVID-19. Now, let's just go over the pathway and I'll tell you more about this. So this is the blood vessel over here, and you have the virus enter through what we call the alveolar lining. This is an alveolar cell, which is the lung cell, what the virus infects. So the virus comes in over here, enters into the alveolar cell, and this is where you have a step called viral replication. Now, viral replication takes place by using a drug called viral polymerase, and that's what helps the virus multiply even more. That step, we know, can be actually inhibited by a drug called remdesivir. So that's one step, and once the virus is actually released into the circulation, that's when you have something called the cytokine storm over here, which is a fight between the virus and the body. Let's just go over the steps one last time to be clear on this. What are the steps? So first phase, in an infection with COVID-19, you have the viral phase, which is the virus enters the body, has a little fevers, little chills, little body aches, not feeling great. The second phase is the interaction between the virus and the body. The body, like I told you, is what we call a cytokine storm. This is where things start to rev up a little bit more. The patient develops a pneumonia, some shortness of breath, and requires supplemental oxygen. And the third phase over here, this is when the whole immune system goes crazy to fight things off. A cytokine response situation over here, and that's where dexamethasone has been shown to be beneficial. Now, it's not been recommended, but over the past few months, we as physicians, when hydroxychloroquine and azithromycin disappeared off the market over here because it wasn't useful, a lot of us started using steroids in the treatment over here. We used a drug called methylprednisone, which is Solomedrol, what we call it over here. The trial involved things like dexamethasone over here, which is shown to be beneficial. Now, I really want to point this out. Dexamethasone has only been shown to be effective in moderate to severe cases. So in moderate cases where someone has a pneumonia, or severe cases where someone's put on mechanical ventilation or intubated, these are the only places. In people who with mechanical ventilation, it decreases the death rate by about 35%, and people who have a pneumonia, 20%. Now, it's very important. If you're diagnosed with COVID-19, remember, more than 80% of people are asymptomatic. So don't go to your doctor and ask for steroids, not indicated. Every medicine, as you know, has a risk versus benefit situation, and certainly steroids can be dangerous in certain situations. Okay, moving on to the rest of the planet over here. This is what we have. I love the Hopkins map over here, which tells us what is really going on all over the planet. Once again, the United States continues to top the chart with not a very proud thing, but we're actually topping the chart with 2.1 million infections all over the world, 116,000 deaths. Let's look in over here. These are on the rise. Brazil really rounding up, exploding right now, but it's in second place. Russia increasing, India increasing. And these are some of the things I want you to know. So this pandemic is not over. What's not on the list over here is China. Now, from Saturday onwards, China has seen about 80 new infections. Similar situation as Wuhan, and I really don't know why they haven't stopped this. This is at a market called the Zenandi market. And this market, the size of this market, just to put in perspective, 250 football fields. That's the size of this market in Beijing. So that's very concerning. And Beijing, what they've done, locked down to the maximum. draconian measures, almost seems like a war city over there. And these are some of the things I feel why China succeeded and the United States failed. China actually contained this. Remember, they're the first country. They contained this to 88,000 infections initially, while we didn't do a proper lockdown. We didn't wear masks initially, and that's why we're way up here at 2.1 million cases. This is far from over. Let's look back a little bit locally over here. You're seeing the United States map over here. We saw, of course, New York was hit very badly over here, and you see the number of cases. The places is really troubling right now are Arizona, Florida, Texas. And why are these happening? Why are the cases going up over there? That's really a result of people opening up the states without science or statistics, where people say, well, you know, we've gone through this for about 8 weeks, it's time to move on, and opening the economy in these states. Now remember, it's very important to open your economy based on science and statistics. So Florida right now actually had about 2,700 cases yesterday, constantly rising, and they still want to keep the state open. What I think is important to do is when you're reopening a place based on science, it's very important to say, well, we're going to reopen based on the facts of science and still continue to social distance. Wear your mask, 6 feet distance, and of course, wash your hands. So you have to keep this in place. If we're not doing that, we're going to see a spike in cases. Now, some argue that you're seeing a spike in cases because there's more testing, but I don't feel that's the case. We're definitely seeing new infections, and that's worrisome. Also, to put this in perspective, this is not a second wave. This is definitely not a second wave. We're still part of the first wave, to watch very closely. Moving on, let me just show you an example of Alabama, another place which started out very slow, and now it's increasing. Remember, this is still the first wave. Why has this happened? You guys know. Prematurely opening the economy and people not social distancing. Another big thing that I think over here is the governor, no disrespect, when she goes live on television, she's not wearing a mask, like other politicians as well. And when these kind of things show up on live television, people actually take those advantage, take their lead and say, well, my politicians are not wearing, why should I be wearing? Remember, America, this is not about freedom. This is about keeping all of you safe. So wear your mask, keep your distance, and of course, carry hand sanitizer. For now, it's Dr. Rajiv Fernando reporting for Infectious Disease at Chirag. Thank you.